As we've been telling you this morning, Philadelphia is scaling back its green phase of reopening that was scheduled for this Friday. The city announcing those changes yesterday. And joining us now live this morning is Philadelphia's Health Commissioner, Dr. Thomas Farley, to discuss this, what I can imagine was a tough decision. Good morning, Dr. Farley. Good to have you with us this morning. So,
good morning.
Thanks for being here. We want to get right to it. What was it specifically that led you to say we need to slow down and pause Philadelphia's reopening?
Well, the coronavirus cases in the Philadelphia area are rising now after falling for a long time, and nationally the cases are surging. So we don't want to become another Houston or another Florida where we see a big rise in cases. But it's better to pause now and just see how much this is going to affect us here in Philly.
Understand wanting to be better safe than sorry. So break down for us what will remain closed and what will be allowed to open.
Well, we will not allow restaurants to permit indoor dining. Restaurants can still have outdoor dining, and they can do delivery, they can do takeout. And we'll also pause in reopening gyms and indoor fitness centers. But we will allow certain activities that are lower risk to open up. That includes museums and libraries and indoor shopping malls and the casino under some very strict requirements where there's no eating, drinking, or smoking. And we'll allow outdoor gatherings of up to 50 people.
All right, so low-risk activities will be allowed to slowly come back on board. You mentioned this. We have been watching other states around the country spike in their number of cases and hospitalization. So what have you been sort of taking from that, and anything that you've been learning from those cases there that you'll be applying to here in our region?
You know, I think these other states opened too early and too recklessly. So we don't want to make that same mistake here. You know, the virus hasn't changed and human biology hasn't changed. So if we go back to our behavior February, the virus is going to come back. So the key here is really for people to wear a mask at all times when they're around other people. That's why we passed an executive order that requires use of masks when people are in indoor public spaces or outdoors and they're going to be near other people. And then people ought to be trying to stay away from other folks, more than 6 feet. The virus doesn't fly that far. They can remember those two things, masks, distance, and then hand washing. We ought to be able to keep this under control.
And of course, everybody wants to stay safe, but obviously everybody also eager to see the city reopen, see people get back to work, businesses reopen as well. What needs to happen for the city to fully reopen? And at this point, do you even have a date in mind?
We simply said that we don't think it's likely we're going to open the bars or the restaurants for indoor dining before August 1st. However, we will reevaluate on a week-by-week basis. I can't lay out any specific things that would let us open them. I can say that we're going to be looking very closely at the case rates and whether they're rising, whether they're falling, and also how much people are following their recommendations and requirements on masks.
And so as we approach the July 4th holiday, you know, a lot of people thinking about heading down to the shore this weekend, and casinos and amusement parks are now open, amusement piers. What are your concerns for people from Philadelphia who may be heading to the beaches, and what advice would you offer to them?
Well, the biggest rise we're seeing right now is the cases in young people, in the teens and 20s. And we've heard anecdotally a lot of these people appear to have been exposed at the beach, not necessarily on the beach itself, but in beach bars or staying at shore houses where they get in close contact with each other. So we're recommending people stay away from that right now. That appears to be the hot spot, or these beach places. I know people want to go down there over the July 4th weekend, and I really appreciate that, but that appears to be the most dangerous place to be right now. So we'd recommend people stay here in Philly.
All right. Philadelphia Health Commissioner Dr. Thomas Farley, thanks so much for your time. We always appreciate your insight. Stay safe. Thank you.
Thank you.